Well, in Health Watch, the nation's top health officials are growing more concerned about the possibility of another winter COVID surge.
In recent months, the Biden administration has struggled to encourage Americans to get the updated vaccine. Several mutated versions of the Omicron variant are sweeping across the globe. What's more concerning is these new subvariants could be resistant to current vaccines and treatments.
That's really the essential point there, Nikki. Joining us now to discuss is Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases and President Biden's chief medical advisor. Dr. Fauci, so good to have you here. So, as we were discussing, COVID cases up in Europe, up in Asia, and with reports of potent new strains, how concerned should all of us be about the possibility of a really terrible winter ahead?
Well, obviously, you always want to be prepared for something like that. It doesn't necessarily have to happen. And particularly since we do have the wherewithal to help mitigate that. You had mentioned that there are variants that are now gaining traction in the sense that there's a greater proportion of the isolates are newer variants that are not the BA5, which had been previously the dominant variant that we've seen. The new variants are of concern, but one of the things we want to clarify with your viewers is that the vaccine now, the bivalent BA5 vaccine that has been available for the last month or more, does very well against the dominant circulating strain, the BA5, and even the new strains are actually sublineages of BA5. So there should be reasonably good cross protection. The thing we're more concerned about is that the new variants seem to be able to elude the protection of the monoclonal antibodies that are given to people who are severely immune compromised, who may not respond well to the vaccine. That's the biggest concern, more so than the vaccine itself losing its capability against the variants.
Dr. Fauci, what should those who are immunocompromised then do as we head into the winter and a potential surge?
Well, first of all, even though they may not respond as well as an otherwise immune competent person, they still should get their updated BA5 bivalent. I think the idea that just because they're immune compromised that maybe the vaccine won't work as well is not a reason not to get your vaccine or not to get your boost. Second, they should realize, and their physicians who take care of them should realize, that we have very good antiviral therapies that work against all of the variants, things like Paxlovid. So if an immune compromised person does get infected and it breaks through the vaccine protection, you want to make sure that person immediately gets access to the direct antiviral drugs that we know go a very long way to keep people from advancing to severe disease.
Get your vaccine. Dr. Fauci, I also want to ask you about long COVID, something so many of us who have tested positive have worried about. But how much do we know about long COVID and what the symptoms are?
Well, we know a lot about it, but there are also a lot of unknowns. We know that it is a real phenomenon. It's estimated, given the large number of people in the United States that have already been infected, anywhere from 7 million to over 20 million people have the prolongation of symptoms for weeks to months following the resolution of the acute infection. And about 1 million of those people, the disease, if you want to call it that, the syndrome that they're experiencing, which we call long COVID, is so severe that it's incapacitating them enough so that they're not able to work. So that's the epidemiology of it. The mystery of it is we still have not been able to figure out what the underlying pathogenic mechanism is. And by pathogenic mechanism is, what is it that's going on that has someone who is otherwise a polished athlete have severe fatigue following exercise, which they've never had before? What is the basis of the sleep disturbances? What is the basis of the brain fog, where people who otherwise were very sharp intellectually have trouble concentrating for any period of time in front of a computer or in front of a book. Those are the things we're working very aggressively on to try and find out what those mechanisms are, because you can't adequately treat something unless you know what it is that you're treating.
Yeah.
And that's where a major effort is going to try and find that out.
Dr. Fauci, I want to follow up with you on that because, as you described the mystery of it, given so much that's unknown about long COVID, the possibility of another wave, should the administration plan to extend the COVID public health emergency through past January? I'm reading reports that up to 15 million people, according to HHS, could actually lose their health insurance if the administration decides that the COVID pandemic is in fact over.
Well, that's going to be a decision that will lie with the Secretary of HHS and the administration. I'm not going to opine on that. I just know that we still have a significant problem. And right now, we are dealing with all the things that you just mentioned, the ongoing outbreak that we have, as well as the threat as we get into the late fall and the early winter. Those are all things that must be considered in any decision that you make.
Dr. Fauci, in the news today, the National Institute of Health is examining a series of COVID-related experiments performed at Boston University that combine the Omicron strand with early strands of COVID. Could you explain why there's concern about this research and what they were hoping to learn?
Well, first of all, the National Institutes of Health did not support or fund that research. That was independently done by the Boston University group there. They were trying to determine what the mechanisms of why the Omicron variant appeared to be less virulent than the original Wuhan strain variant that we experienced in the very first months. So they did a number of experiments to try and determine what those mechanisms are. So it was interpreted, I think, in an exaggerated way by some as being of great concern. These were things that people asked us, did we support those experiments? And we did not. We did not at all. That was not part of the grant that particular institution was given by the NIH.
Dr. Anthony Fauci, thanks so much for taking the time to join us. Thank you.
Appreciate it.
Good to be with you. Thank you for having me.